So these days you have heard a lot about myositis because one of the actresses, Samantha, has come out saying that she has been diagnosed and treated for myositis. So today I am going to tell you a little bit more about myositis. Hi, my name is Dr. Aruna. I am a rheumatology consultant at Arete Hospitals. What is myositis? Myositis is where there is inflammation in the muscles in the body. So any type of muscle in the body can be involved in myositis. Like generally what happens is people get inflammation in the muscles involving the hands, the thighs, the legs and so on. But a small percentage of patients can also have involvement of the muscles which help them to swallow food and breathe, etc. So the common symptoms patients we see in clinic is with weakness in the muscles, where the patient is unable to climb stairs or get out of the chair without support, or if they sit on the floor it is very difficult for them to get out. Sometimes we do also see patients where there is involvement of the muscles of the food swallowing muscles and breathing muscles, where they can develop shortness of breath, where the oxygen levels in the blood fall and so on. Who gets myositis? Myositis can involve any age group based on what type of myositis they have. Younger patients can have myositis, type of myositis called polymyositis. Elderly patients can have a type of myositis which is called dermatomyositis, where they have myositis along with a rash, especially on the face and the hands and so on. So any age group potentially can develop myositis, but it is usually seen in the later life. So apart from the muscle pain and muscle weakness, the patients also may have other symptoms like not feeling well, tired, loss of weight, loss of appetite and so on. Sometimes myositis may be associated with the underlying cancer, so they may have symptoms associated with that. So we need to be very vigilant when a patient comes with myositis to the clinic, very vigilant about what exactly is happening, whether they have any other underlying problems which is causing these symptoms, and we need to ask questions and examine and investigate accordingly. Usually myositis is an autoimmune disease, but there are other reasons why patients can have muscle pain. Sometimes the patients can have thyroid issues, medications we use to reduce the cholesterol, and sometimes bacterial, viral and other infections also can cause pain in the muscles. So we need to able to differentiate whether it is because of autoimmune myositis or it is something else which is causing these muscle problems, and we need to investigate accordingly. What are the common tests we do to diagnose myositis? First and foremost important thing is examining the patient and taking a proper history will help us to come to a suspicion of myositis. Basically, we do blood tests to assess the activity of the disease and the severity of the inflammation in the muscle, and we do sometimes tests to rule out other causes for the muscle pain like thyroid function test and so on. There are other tests like MRI of the muscles, and there's a test called EMG, and sometimes if necessary we might do a muscle biopsy also to come to a proper conclusion and also to see what type of myositis they have. Once we diagnose myositis, then the treatment options are medical treatments and other forms of treatments depending on the severity of the disease. Suppose if the patient has involvement of the respiratory muscles, those are the muscles which help us to breathe normally. If there is involvement of the respiratory muscles, then we need to act immediately because we don't want the patient to have a severe respiratory problems or respiratory failure, in which case we need to admit the patient immediately and start them on steroids. Along with the steroids, we also give other treatments. We call them steroid sparing agents or disease modifying agents. Not everybody may need high dose steroids. Depending on the severity of the disease and whether they have any involvement of the respiratory muscles or not, we will decide on the route and the dose of the steroids as well. So along with the medication, once we rule out other causes of the muscle problem, the most important thing is we need to strengthen the muscles, because once the muscle becomes inflamed, it loses the patient loses the power in the muscles because they haven't been using because of the pain and so on. So we need to focus on physiotherapy and education of the patient that they need to do the exercises to strengthen the muscles. That is one aspect. Second thing is tell the patient that they have to be compliant with the treatment. As soon as they start improving the symptoms, they might stop the medication, worrying about the side effects of the medication and so on. So compliance with the treatment and physiotherapy plays a very important role in treating the myositis. So in conclusion, myositis is something where we need to look into it very seriously. If you or your family members or somebody in the family has a difficulty in getting in and out of the chairs, if they have difficulty in managing by themselves where they were independent until recently, if they have any severe muscle pain, and if they are losing weight and if they have rash, then that is something which we need to take it seriously and advise to get it checked. So if you find this video useful, please share it with your family and friends. Thank you.